So the first part of the testing is just kind of general observations. And most of these I make while I'm taking the history on the animal and just watching the animal walk around the exam room. Things like mentation, are they mentally appropriate, head posture, head coordination, and whether they're pacing or circling or head pressing, and also the history of seizures, because these all indicate some problem, of course, up in the head above the level of the foramen magnum. So that's the first part of our examination, are these observations. Next, we're going to start with the cranial nerves. Remember, there's 12 cranial nerves. And the great thing about the cranial nerves is, especially cranial nerves 3 through 12, are lined up perfectly going down the brainstem. And so they're great little localizers of lesions, because it's very hard to have any lesion of any size in the brainstem and not pick off one of these cranial nerves. So we start with the menace response, and in the menace response, the hand is advanced toward the eye, and you can see the blinking of the eyelid. So they have to have normal vision for this, they have to have normal mentation to process this as a threat, and they need to have a normal functioning facial nerve palpebral. The second test that we do is the pupillary light reflex. Oh, we're going to stand up now, huh? Okay. Is the pupillary light reflex, and we shine the light in the eye and observe the constriction of the pupil. That's the direct response. And then we observe the other eye and make sure it's constricting the same amount. Sometimes I'll just quickly go back and forth to see if the pupils are the same size, and yes, they are. And that tests cranial nerves 2 and 3. Then we're going to look at the position of the eyes to determine if there's any strabismus. Remember, strabismus is the abnormal position of the eyeball. Either inward or down and out are the most common ones. The ventral lateral strabismus is the most common. And we want to make sure that the eyes are working together in order for us to say that cranial nerves 3, 4, and 6 are okay. And she looks real good. We're also going to look for positional strabismus, which is usually a function of the vestibular nerve, cranial nerve 8. So we're going to elevate the head and make sure that the position of the eyes remains equal. And if there is a problem with the vestibular nerve, oftentimes the eye on that side will deviate downward compared to the other eye. So that's strabismus. Then we're going to check cranial nerve 5. And in cranial nerve 5, we're going to palpate the temporalis muscles and masseter muscles to feel for any atrophy. And we're going to check jaw tone. You can see it's real good there. And she can close her mouth completely all the way. Okay, the next is a series of tests on the sensory branch of the 5th cranial nerve and the facial nerve, the motor part of the facial nerve. And that is the palpebral. See, we're touching the medial canthus and the eyelid closes. They feel it with their 5th cranial nerve and close their eyelid with their 7th. Then we tickle the ear, and you can see her move the ear away. She definitely feels it, and she's moving her ear with 7. So she feels it with 5 and moves the ear with 7. And then the third branch is the lip, and we pinch the lip, and you can see the nose moving a little bit, and she definitely was feeling it as well. So that's the series with cranial nerves 5 and 7. The next thing we want to test is cranial nerve 8. Now, of course, we've already looked to see if she had a head tilt, because oftentimes with cranial nerve 8 vestibular nerve problems, they'll have a head tilt if it's unilateral. And the other thing we want to check is physiologic nystagmus. Now, when we move the head, if you look at the eyes closely, when we move the head to the right, there's a few beats of nystagmus with the fast phase toward the way that we're turning to the right, or to the left it goes to the left, to the right it goes to the right. And this means that the cranial nerve 8 bilaterally is in pretty good shape. So that's normal physiologic nystagmus. We certainly want to examine for any nystagmus that is just spontaneous, because that shouldn't be there either, and indicate some type of imbalance in the vestibular system. The next cranial nerve is 9 and 10, and there may be history of a change in bark, which is, or some difficulty choking on food and swallowing, or megaesophagus regurgitation. But when we actually test it, we usually will just palpate the larynx here and pharynx and get her to swallow, and you see that she did that fine. So 9 and 10 are okay. And then cranial nerve 11 are the trapezius muscles here, and we can just palpate for any atrophy on her neck, which looks good. And then lots of times we can see if she can lick okay. We can blow on her nose and see she licked. We can also open her mouth and actually observe the tongue and palpate the tongue, and that evaluates cranial nerve 12.